Collar
Start
down.
it right now.
Okay, so Mr. Feliciano is comfortable having the trach removed. What we'll do is make sure the cuff is down. Okay.
What is that
It
blue
appears
thing?
down. It's the balloon that just indicates whether the cuff is up or down. So if I put air into here, it just is a sign that shows what air is in the cuff in the trach. So if this is inflated, then that is inflated. But we'll take this down. Okay. Cuff is coming out. Trach is coming out. Okay. All right. We just pull that out. Bit of secretions there, which we can clean up. This is the salivary tube. It's a bypass tube, and it's a T tube. So there's one running inside, and then like a T, there's this exit. And what we're doing is just healing the tissue around it. So underneath, you can see down there is an opening where the skin has broken down. And so what we do is wet to dry dressings, which are what they sound like. They start wet and then they dry, and the whole purpose is to take any sick tissue with it when you pull it off. You want to pull it off gently, of course, but
Just
it's
light. Just putting light there.
Oh, great, thank you. It's moist when it goes on. Not dripping, but wet, moist.
And the purpose of
So I squeeze this out. I just get this wet and I squeeze it out. Okay, so it's not dripping anymore. The purpose of it, I'm sorry?
is to wick away the
Secretion.
secretions, right? It doesn't.
Yeah, and any ill tissue that happens to be forming there, so it's wet when it goes in, and then it dries, and it'll adhere to a lot of the sick tissue there, and pull it off. So any tissue that is either fibrinous or unwell, that's starting to develop, can come off with it. So.
And it's not like you're packing a wound to stop bleeding or anything.
No,
It's
just surface packing. So it's just moist, and I can even use my fingers or cotton tip applicators. Actually, I'll use one of these gauzes to just clean the stoma here. Okay, there's just some crusting from secretions that is formed. So you can wipe that away, making sure everything's clean. There was concern about reflux, so we are thinking that a lot of this looks like some reflux of feeding, tube feeds. So what we want to do is have him elevated in the bed at all times, 30 to 45 degrees, instead of laying flat.
Yeah.
At all times.
At all times.
That'll also help his lungs, right?
It will.
Drain.
So we will, let's see, just do this. It's just moist. It goes into here, it populates the whole area. We make sure that it's not obstructing the stoma. Okay, we can even put this up here around so that when you take the trach, and actually I want to clean the trach.
So the liquid that you moistened with, what is that?
It's normal saline.
Thank you.
These are just some secretions here. There's a sterile gauze.
And that's the cup in its deflated
Correct.
position,
Correct.
that plastic thing.
This balloon right here. We'll just string this back through. Insert the trach sideways and then back down. Great. Mr. Feliciano has a strong cough. It's always reassuring. Okay. And then with 2 fingers, I can fit 2 fingers in here comfortably, but it is fairly tight so it won't go out of place. I have it back in place. This I leave a little trail so that I won't lose it. And that's it. We have low by oxygen.
Do you fill the balloon every time?
So we can just fill it a little bit slightly. You don't need to because Mr. Feliciano is tolerating his secretions. He's coughing up what he needs to. We inflated just a tiny bit because it might help with protecting his airway just a bit, but for now, it's very soft. It's very soft here. So it's not fully inflated as you would have a ventilator or something like that, but we put a little bit of air in it. Okay.
But always deflate completely
When you're removing it or putting it back in. Correct.
the tray.
Definitely. All right.
Okay.
And removing the air from it takes you do it with the syringe, create a vacuum,
Yeah. Just a syringe.
and pull the air back out.
Correct. Yeah.
Okay. That's
Thank you.
that's a wrap.
That's